This is Group Oncoclínicas at ESMO 2023. And I'm here with Dr. Antonio Llombart, co-founder of MedCir and medical oncologist based in Spain. And he's presenting a paper here at ESMO. Doctor, we're going to have this presentation pretty soon. And what are the main results?
Okay. As you know, over the last 2 years, we have done several presentations on a very specific study that is the PHERGain study. PHERGain is a practice-changing study in which we confirm that patients with HER2-positive, locally advanced or early breast cancer can be cured without chemotherapy, at least for a whole proportion of those patients. That was the main presentation last year at ASCO. And now what we present are data related to how we can optimize that. So one of the presentation relates to trying to optimize by defining better the tumors. And that's through a genomic platform in which we analyze all the tumors. And it gives us an information regarding the chances of the tumor to respond, as well as the chances of the tumor of the patient to behave well. So the signature, it separates patients with aggressive disease from those with not so aggressive disease. And it's very interesting when we combine the information from the signature and the results from the PHERGain study, that there are a large number of patients that we can identify as having high chances to respond extremely well just to the combination of trastuzumab and pertuzumab. But it's also very interesting to observe that patients with aggressive disease, there is a cohort of them that did very well. And the ones that did very well by the molecular platform, they were as we call as low risk. So in the future, we will be able to adapt this information to be more precise in terms of identifying the patient that will not require chemo, even if the treatment is not perfect in terms of final results. So in the patients that do not achieve a PCR on exclusive trust to pertuzumab, probably those patients do not require also more aggressive treatments in order to prevent the risk of relapse.
Is the study still ongoing? Are you going to have other kind of results?
The study is ongoing in the follow-up. Okay, all patients finished treatment more than 2 years ago. We presented data on the follow-up at 3 years this year, but we expect to collect data up to 7 years. The other thing is that we are also compelling this study with new molecular sub-studies just to identify and characterize much better the patients that did well from the patients that didn't do so well. So we are also planning a new study that we are now negotiating. It's what we call PHERGain 3, in which we'll introduce these modifications in order to improve the number of patients that will not require chemotherapy, as well as identify those very aggressive that we will change much earlier the treatment.
So I hope to talk to you soon at other meetings about these new results. Thank you, Doctor.
Thank you.